Hey, what's up, team? I get asked quite a bit about upright rows and how to troubleshoot them. Different ways you can do them if you're having shoulder discomfort or ways that you can prep for them to keep them in your program. So I wanted to walk through my thought process on ways to troubleshoot your upright rows and to keep them in your program and prep for them if you want to, or when to decide if maybe it's best if you just take them out. So first things first, upright rows for a lot of people do cause discomfort in the shoulder just because they do put it in a precarious position where you're arm is abducted out to the side and your wrists are low, so your shoulders internally rotated. For a lot of people, this can cause what is referred to as impingement, or it's just a shortening of the space where those tendons of your shoulder travel through and just causes compression on them and discomfort over time. So, some things that we'll talk about is how to alleviate and make sure those tendons have a good area to glide through. And just we'll talk about a lot of modifications of that. But it's good to understand why that even causes discomfort in people in the first place and why for some people, especially people with previous shoulder injuries or just a lot of limited and poor scapular movement, shoulder blade movement, it may be worth considering just taking them out of your program indefinitely and then coming back to them later on. So the first thing that I recommend on the days that you're going to be doing your upright rows is to improve the actual prep that you're doing ahead of time. So this prep can involve things for your shoulder blades, for your upper back, and then for your shoulders specifically. So the first thing I usually recommend for people, because a lot of us have stiff upper backs and poor control of our shoulder blades, is to do some sort of thoracic spine or upper back rotation movement. There's tons of these you can find online. If you want anything specific, feel free to DM me. I'll send you something. Some of these are just referred to as like the thread the needle mobility drill. There's like the world's best stretch and all these other things that you can do that are great for kind of opening up your upper back and getting your shoulder blades warmed up as well. Next, I like to do the lock 3 shoulder routine. This is again just another great all-around shoulder warm-up, whether you're doing pressing, whether you're doing upright rows, any type of upper body movement. This looks at warming up your rotator cuff a little bit more, and then also your shoulder blades, like just like the rotations did. Next, we have wall slides. This is a little bit more specific to actually getting engagement from the shoulder blades, but it does a good job of warming up the protraction and retraction movements of your shoulder blades, and then also engaging them for elevation and depression. So just warming up, getting a good mind muscle connection with your shoulder blades. Finally, we have some sort of external rotation drill. Specifically, I like the one with your elbow on your knee. You might have seen online. If you haven't seen this and you want a video on how to do it, I'd be happy to send you that as well. But we have the elbow on knee external rotations. They do train with some level of specificity for this because they put you in a similar position and they allow you to lengthen into that internally rotated range and gain strength and mobility into and out of that range. So those are great. You can also do the external rotations with your elbow at your side. Nothing wrong with those. Just looking at getting your shoulders nice and warm. You don't want to turn this into a whole nother workout. So I'd usually just say pick 2 to 3 of these. Do 2 or 3 simple sets of 10, get some blood flow moving, get a good mind muscle connection with those areas. And then if you're finding it's not working for you, try and swap 1 or 2 of them out and just kind of find the right routine for you over time. The next thing you can look at troubleshooting for upright rows is changing the actual path of your row. So with free weights like barbells and dumbbells, you're going to be pulling with the line of gravity, which is pretty much straight up and down. That can cause some discomfort for some people. What you can do for some relief right away is look at using a cable attachment so you can set it nice and low and then you'll actually step away from it, which will allow you to pull up and back. And then it will pull down and forward coming out of the upright row. So for a lot of people, this can cause relief right away, just creating more space for your shoulder to move through. So if you want a quick little adjustment that you can make, the upright row with a cable attachment can be an awesome one to just start doing the movement and then work on all this other prep and mobility over time. Next, you could look at switching the equipment. So oftentimes with straight bars, if you have stiff wrists or just discomfort with your wrists, that can cause your shoulders to also try and compensate and some discomfort at your shoulders just from wrist positioning. So easy bars sometimes can give you some different bends that you can grab, better wrist angles for some people. So give an easy bar a shot if you've only done straight bar variations. Next, you can look at doing dumbbells. So these give you more freedom, especially side to side. So if you do have any asymmetries or strength imbalances, etc., if you're not perfectly symmetrical and balanced, which most people are not, these can allow you to move a little bit more freely side to side without causing pain, trying to compensate on one side or the other. And then finally, using Smith machines can be great because they just take out a lot of the stability of the forward and back motion of a barbell or dumbbell, and they allow you just to focus on pulling with the target musculature basically straight up and down on a little bit of an angle for some machines. So Smith machines can be an amazing way to train the actual movement, the mind muscle connection you need, and get away from the stability portion of it if you struggle with that. And then you can come back to it long term with dumbbells and barbells. The next thing you can look at doing is just adjusting your grip width. So a lot of times if people go a little bit wider, a little wider than shoulder width rather than super narrow, they'll find some relief just because you won't be quite as internally rotated throughout the movement at your shoulders. So this is a good fix kind of short term. Usually the reason narrow grip even stays in the question, or you see a lot of people doing it with a more narrow grip, is because they usually get a better stimulus for their delts by doing a bit more of a narrow grip. Not everybody, but a lot of people do. So it just comes off with the trade-off of usually you'll internally rotate your shoulders more, and if they can't tolerate it, you're more likely to cause yourself pain. So try a wider grip if you are getting discomfort. Try a wider grip for the interim, and then you can move your grip closer as your mobility and your control with the movement improves over time. And if you're not getting pain, more narrow grip can be great, and it might give you a better stimulus for your delts. So try a wider grip if you need to, and then move towards a narrow grip if you want a better stimulus or just want to try it out again. The final thing to try with your troubleshooting is the actual just pre-fatiguing of your shoulders in general. So you can start with something like lateral raises, get your shoulders nice and tired, nice and warmed up, and then do upright rows later in the movement. If you do this, you usually don't have to use as much weight, and there'll be less joint stress, as you're performing the movement. So you can focus on getting a good stimulus for your delts because they're already nice and tired, but you don't have to use as much weight to do so. So this is similar to the prep idea where you're just getting your muscles and joints ready for the movement. And in this case, you actually take your delts close to failure, so the target muscle is already nice and pre-fatigued and prepped for you ahead of time. The final thing to consider, if they're causing you joint pain, if you've tried some of these to keep them in your program and it's just not working for you, is just to replace the movement. So the idea with upright rows for most people who aren't competitive athletes doing overhead movements like Olympic lifters and stuff, the main idea for them is just to train your delts and oftentimes a little bit of your upper back. So if that's what you're trying to do with upright rows is to train your delts, there's tons of ways to train your delts. There's lots of lateral raise variations with cables, machines, dumbbells, different angles you can hit your delts with the cable variations and the dumbbell variations, etc. So you don't really have a shortage of ways to target your delts, and you just have to understand that when you're training and you're trying to target a target muscle, that the main idea is just to create a good stimulus for the target muscle. It doesn't care what exercise you use to do it. If upright rows are an amazing way for you to do that, then fight to keep them in your program. But if they just always give you shoulder pain, or if you have some limiting shoulder stuff that you came into your training journey with, then you can just move on from them. They don't mean you can't get big delts. You can get big delts doing lots of other things so long as you target them correctly and overload them and do all the good things. Long-term fixes, if you do want to keep upright rows in your program and you finally got to that point where they're not hurting you, is just to keep working on the same stuff that we already discussed. So working on good thoracic spine mobility over time, just making sure your upper back is moving properly so that your shoulder blades have a good surface to glide across and they can kind of control into and out of these ranges of motion is super important. Working on improving internal and external rotation, strength and mobility long term, just making sure your rotator cuff is nice and healthy. And then strengthening the actual movers of your shoulder blades, which you can do with just different rowing variations, making sure you're moving into and out of good deep ranges of motion with your presses, with your rows, with dips, with different stuff, push-ups, etc. Just making your shoulders and shoulder blades can tolerate these deep ranges of motion will give you a better likelihood of being able to survive some of these other shoulder movements that do put them into precarious positions. Some final thoughts on all of this is that upright rows are definitely not mandatory, but there is a lot of ways to troubleshoot. So if you feel like you do want to keep them in your program, it's worth giving it a shot. Going down the list of different things that you could try, different grip adjustments, machines, variations, stuff that you can do to make sure you're good and warmed up for them and you give them a fighting chance. But like I said, they're definitely not mandatory. You can grow your delts doing lots of other things. So you can just modify or replace this movement as needed. It's really not a die-hard rule that they're bad for everybody, that they should be in your program to grow big delts, etc. It's just what works for you. But if you guys have more nuanced questions on this, feel free to ask me. I'll be happy to talk to you in more detail. The main goal of training your delts and of doing any movement in the gym really is just be able to train hard. Ideally, do it pain-free, and then just progress intelligently over time. So if you're having pain, it's hard to progress. It starts to limit other movements as well. So you got to consider the most intelligent thing and trade-offs for you in the short term and long term. Finally, Just let me know what you guys think I should cover next. Drop a comment below. Let me know what lift you're having troubles with, any pain points that you guys have, any nutrition things you guys have questions with, and I'll be happy to break it down for you and hopefully provide you guys something useful to take away from these videos.